PEP Radio Newsroom. This is the lunch hour news blast for May 20th, 2025. The Philadelphia Gay News is reporting that amid the chaos and confusion wrought in the first 100 days of Donald Trump's second term as President of the United States, particular concern has been focused on the ongoing decimation wrought on health agencies, programs, and funding under the umbrella of the Department of Health and Human Services. Under the direction of HHS Secretary Robert Kennedy Jr., and with the ruthless budgetary scalpel of Elon Musk's DOGE, more like a chainsaw, a number of HHS agencies have lost hundreds of researchers and other employees. The Centers of Disease Control and the National Institutes of Health being only the beginning among the HHS programs in the crosshairs, including the Ending the HIV Epidemic Initiatives, or EHE. EHE was created with the ambitious goal of reducing HIV incidence by 75% in 5 years and by 90% in 10 years. The program started in 2019 during the first Trump administration and continued under the Biden administration. However, its future under Trump 2.0 looks bleak. The Kaiser Family Foundation, a nonpartisan medical think tank that focuses on health policy research, polling, and news, recently released a briefing report titled, "What Does the Future Hold for the EHE?" The report outlines the program's jurisdictions and activities and postulates the future of any EHE funding. The EHE prioritizes 48 U.S. counties that were the hardest hit by HIV between 2016 and 2017, including Philadelphia County. Others prioritized locations including San Juan, Puerto Rico, Washington, D.C., and 7 states with a substantial rural burden. While there has been no formal announcement, a leaked document detailing budget and restructuring plans for the Department of Health and Human Services suggests there will be significant changes to the federal HIV response, including eliminating the EHE. The leaked document is not official policy and not a final budget request. While Congress could still theoretically fund the initiative, it appears unlikely the Trump administration will champion the effort. And Republicans in Congress have shown little willingness to challenge anything Trump does. While the EHE has not reached its stated goals, it has still made significant strides in ongoing efforts to battle HIV infection through its 5 years of existence. EHE funding extends the reach of the Ryan White HIV/AIDS program, the nation's HIV safety net program, providing care, treatment, and support services to about half of all people with HIV, allowing the program to focus on engaging people who are newly diagnosed in HIV care and treatment and re-engaging others who have fallen out of care. It also supports training activities. Thanks to EHE funding, the number of newly engaged clients served by Ryan White providers increased by 87% from 2020 to 2022. Additionally, the number of clients re-engaged in HIV care served by EHE providers increased by 171% in that same time period. Furthermore, the number of patients provided with PrEP services in EHE-funded health centers increased by 26% compared to a 4% increase across health centers nationwide between 2021 and 2023. The list of public health agencies whose HIV programs have been extended or enhanced by EHE funding is substantial, including the Centers for Disease Control, the National Institutes of Health, and the Indian Health Services, which provides direct medical and public health services to members of federally recognized Native American tribes and Alaska Native people. Recent reports that the administration seeks to cut CDC HIV prevention funding and the actual retraction or freezing of HIV-related NIH grants, such as recently experienced by the University of Pennsylvania, raises questions about the Trump administration's commitment to addressing HIV on any comprehensive level. The administration is also seeking to conduct a reorganization within the Department of Health and Human Services, including the creation of a new agency, the Administration for a Healthy America. There are plans for an AHA to consolidate activities from several different agencies, but what that will mean when implemented is anybody's guess. The Administration for a Healthy America will consist of multiple divisions, including one on HIV/AIDS, but what programs, including EHE, will survive the transition is an open question. That's the News Blast for this hour. Download the Live 365 app to take PEP Radio with you wherever you go. Up next, we have the Meadville area forecast right here on PEP Radio.